My name is Stephanie Wheeler. This is my son, Robert. We call him Reggie. He's 12 and a half. He started with orthodontic and CPAP therapy about 2.5 years ago, a little over 2 years ago, with orthodontic work, and he started on CPAP therapy about 16 months ago. And we are on the other end of our therapy, and we are finishing up with CPAP, and we're moving on to oral appliances. But we were going to talk about how we started this, and if Reggie can remember how 2 years, a little bit more, he felt when we first were sitting in this room to have orthodontic treatment. We thought we were coming in for orthodontic treatment, but we sure got our lives turned upside down, didn't we? Do you remember how you felt?
Yeah, I was tired. I could barely stay awake while he was playing around in my mouth looking at things, and yeah.
Worn out and on a whole slew of medications for ADHD.
Anything else you can name?
And I remember my big thing, and especially we had pictures just in 2 years, what size you were. You were a little tiny dude. You were under 4 feet.
No, I'm like 5'2".
Now you're like
5'2" at least.
At 5'2", 5'3", and you were scrawny. And now you maybe weighed 55 pounds. I can't remember without seeing the records how much you weighed, but now you're up to almost 120. So in 2 years, you've doubled your weight.
Do you think so? That wasn't supposed to be public information.
Do you remember the first time you saw the CPAP and put it on, how that felt?
It kind of freaked me out, but I mean, after I got used to it, it was fine. I mean,
and you were very faithful to wear your CPAP. And Dr. Lucia told us that was a sign of what?
That you're gonna like it.
That it was working for you, because you're not going to use something that doesn't work for you. And then, do you remember how after you started CPAP therapy, did you start feeling more alert, more awake?
Yeah, definitely. I was more awake all the time.
Okay, and now that your jaw is in a better position, we just did a new baseline sleep study, and we found out what?
That I probably don't even need the CPAP anymore after.
That's right. That's pretty exciting, huh? After being really faithful to your CPAP for 15, 16 months, and now you can move on to oral appliance therapy. What kind of medications are you on now?
A big fat 0. None.
Nothing. Yes, that's a good thing, isn't it? Yeah. And you feel like you could conquer anything you want to, right? Okay. So I guess the last thing we have to say is to Dr. Lucia and Dr. Allman, thank you.